Good day, Prof. and everyone. My name is Olumide Adefioye, a doctoral student in the Center for Sustainable Development, University of Abuja. My proposal topic is an evaluation of the implementation of the Community Health Influencers, Practitioners and Services CHIPS program and its contributions to health and well-being in Nasarawa State. Here is my outline, the introduction, the background to the study, followed by the statement of the problem, the research objectives, the research questions, the significance of the study, the review of literature, the methodology, the timeline, and references. The introduction. Nigeria, with an estimated population of 235,348,299 people, operates a multi-tiered healthcare structure that includes primary, secondary, and tertiary healthcare. This multi-level healthcare structure is meant to ensure adequate healthcare provision that caters to the needs of the populace. However, the state of health in Nigeria, looking at health indices, has been poor. For example, infant mortality rates and under 5 mortality rate are still high at 63 deaths and 110 deaths per 1,000 live births respectively. Over the years too, problems that have bedeviled the health sector include the inadequate access to health care. The World Bank in 2021 estimated that over 70% of Nigerians live in rural areas where healthcare facilities are scarce or non-existent. To address these issues, the government of Nigeria in the time past have initiated interventions such as community-based health programs in partnership with multilateral and bilateral agencies. Some of these programs, however, were vertical in nature and led to the fragmentation of health services at the community level. To address this, the National Primary Healthcare Development Agency launched the Community Health Influencers, Practitioners and Services CHIPS program in 2018, with Nasarawa State being the first state of implementation. All the previous community-based programs and their personnel were to be collapsed into the CHIPS program. The statement of the problem. In Nasarawa State, the CHIPS program is being implemented in 52 selected wards across 13 local government areas. Despite the implementation of the CHIPS program, the extent of its impact on health and well-being remains unclear. There is therefore the need to critically evaluate the program's effectiveness, identify its strengths and weaknesses, explore factors that influence its implementation, and make evidence-based recommendations for its effectiveness and sustainability. What are the research objectives? The first is to critically appraise the CHIPS policy program and its contributions to health and well-being in Nasarawa State. The second is to evaluate the impact of the CHIPS program on key health indicators such as maternal and child health indices. The third is to identify factors that influence the implementation of the CHIPS program. The fourth is to explore the perception and experiences of community members, CHIPS agents, and other stakeholders regarding the CHIPS program. The last is to recommend strategies for improving the effectiveness and sustainability of the CHIPS program. What are the research questions? Number one, what are the contributions of the CHIPS program to health and well-being in Nasarawa State? Second, what are the impacts of the CHIPS program on maternal and child health indicators? Third, what are the factors that influence the implementation of the CHIPS program? Fourth, what are the perception and experiences of community members, CHIPS agents, and other stakeholders regarding the CHIPS program? Fifth, what evidence-based strategies will improve the effectiveness and sustainability of the CHIPS program? Now to the significance of the study. The research would identify factors influencing the effectiveness or otherwise of the CHIPS program in Nasarawa State. These factors can then be strengthened if they are positive or mitigated if they are found to be negative. The study will also highlight recommendations for the sustainability of the CHIPS program in Nasarawa State. This is very critical as program, the CHIPS program has been dependent on donor funds to a large extent. And at this time in our nation where donor funds are dwindled significantly, there is the need for an homegrown sustainability strategy for the program. Another significance of the study is that while the evaluation is for Nasarawa State, the findings can also be useful for the reprogramming of the CHIPS intervention in other states. The literature review. Under the literature review, empirical and grey literature will be reviewed and organized under the following headings. The first is the theoretical framework. Two models which are applicable to community-based health programs have been identified, and they are the community health action model and the socio-ecological model. These two will be reviewed, and their key elements will be applied to the CHIPS program evaluation to form the conceptual framework of this research. Other empirical and grey literature that will be reviewed will be organized under these headings that include the introduction to community health programs, and sustainable development goal 3, which is health, good health and well-being, then community health programs in Nigeria, then the overview of the CHIPS program and other headings. The methodology that will be used. For the research design, a mixed method design will be used for this study. This will combine both quantitative and qualitative approaches. The quantitative approach will be a survey, while the qualitative will be in-depth interview. The study area is Nasarawa State in north-central Nigeria. The study population are the states and LGA CHIPS officers, the CHIPS agents, service providers, and mothers of under 5 children. Sample size and sampling technique. An appropriate formula will be used to determine the sample size. While for the sampling technique, simple random sampling technique will be used to select CHIPS agents and mothers of under 5 for the survey, while purposive sampling will be used in selecting the CHIPS desk officers for the in-depth interview. On the data collection methods, a semi-structured questionnaire will be used for the survey, while an interview guide will be used for the in-depth interview. For the data analysis, the quantitative data will be analyzed using SPSS software. Tables, graphs, and charts will be used to visualize the findings. For the qualitative analysis, Atlas TI will be used to organize the qualitative data, while the qualitative data itself will be analyzed using thematic analysis. Ethical approval will be obtained from the state's ethical review committee. This is the proposed timeline of the research. The inception meeting with the project supervisor we hold in February. The literature review would would last till um, early March, while the proposal presentation is expected to be presented. The proposal will be presented around February or March, then followed by the submission of chapters 1 to 3, which will be submitted in May. Then data collection and analysis will start from May to August. The presentation of field findings would take place in August. The write-up of results and discussion uh, write-up of results and discussion chapters would also follow. And then the last on the list is the defense of the thesis. And then these are the references. Thank you very much.